Hello, and welcome to Brief Motivational Interviewing to Reduce BMI, or BMI Squared. I'm your host, Michelle Heisler. I'm a physician from the University of Michigan. These videos are designed for practitioners who've already received some initial training in motivational interviewing, or MI. They're intended to reinforce and extend the skills you've already learned and provide you with additional information and practice to further your learning. However, even if you've had no exposure to MI, our program can still be a helpful tool for you. Pediatric providers can do a lot to reduce the physical, psychological, and economic burden of the increasing pediatric obesity problem in this country. Yet many providers feel ill-equipped to deal with the motivational and behavioral challenges of their overweight patients and their parents. Some providers feel that parents just aren't sufficiently motivated. Others lack confidence in their own counseling skills. Some providers simply feel that such treatment is futile. Motivational interviewing, or MI, can serve as a powerful tool to engage parents and children and improve clinical outcomes. Motivational interviewing is a counseling style that builds patients' own intrinsic motivation for change. It assumes that for parents to overcome their resistance and resolve their ambivalence about change, they require a safe, non-confrontational climate where they feel comfortable addressing both the positive and the negative aspects of their behavior, their fears, their dread, as well as their potential reasons for wanting to change. Ambivalence is seen as a normal stage in the process of change. The counselor helps the person resolve their ambivalence, but does so without pushing them or trying to overly persuade. Patients are provided with a sense of autonomy and choice, from determining what will be discussed to when and how any changes might be attempted. We'll review the basic skills of MI and give you some examples of providers applying them in clinical practice. We'll talk about how the pieces come together in a full MI session. We'll also show you some examples, start to finish, of conversations a physician and dietitian might have with parents of overweight children. Please note, the examples used in these videos are primarily for parents of children aged roughly 2 to 8 years old, and thus we only feature the parents, not the children.